Welcome to PopHealth Week, streaming live on Healthcare Now Radio. I'm Greg Masters, co-creator and executive producer. Joining me in the virtual studio is my partner and co-creator, Fred Goldstein, lead host of PopHealth Week and president of Accountable Health, LLC. PopHealth Week is your trusted source for bold conversations within the leaders shaping population health, from health systems and payers to policy innovators, technologists, and the frontline thinkers tackling the biggest challenges in healthcare. To connect with us, visit popupstudio.productions or follow on Twitter via @PopHealthWeek and @GregMastersMPH, and that's Greg with two G's, to catch all our updates. Today, we're excited to welcome Breanne Buehl, Head of Healthcare and Life Sciences at Broadcom, where she leads strategy at the intersection of cloud infrastructure, AI, automation, genomics, and regulated industries, including healthcare, life sciences, and the public sector. Breanne is a nationally recognized voice on hybrid cloud strategy, digital modernization, and how infrastructure decisions directly impact operational efficiency, equity, data security, and the future of population health. Fred, the mic is yours.
Thanks so much, Greg. And Breanne, welcome to Pop Health Week.
Thanks. It's great to be back.
Yeah, it's fantastic to get you back on. Today, we're going to dive into a fairly technical area that's critically important for population health. Population health and its effective delivery is built on a framework that starts with data. The key is to be able to access that data, all of it, from EHRs to social determinants of health to genomics, etc. Make sure that data is secure because it often contains PHI. Integrate that data. We got to analyze it, particularly now with the boom in AI, and provide appropriate tools, feedback, and responses to make that data actionable. That's what we're going to be discussing here today. So, Breanne, it's great to get you on. Why don't you tell us a little bit about your role with Broadcom first?
Yeah, sure. So I've been with Broadcom for 2 years, but I was part of the VMware acquisition and have been with VMware for about 2 years, 4 years, having spent on the VMware side. I am the head of healthcare and life sciences, as well as head of public sector, which includes federal government, state and local government, and education as well. So, I touch on a lot of the highly regulated industries here. And my role, I'm not part of the sales team. I'm technically part of the marketing team, but I have a broad scope that includes helping our teams understand what's happening in healthcare and how market drivers are impacting the way that our healthcare customers are making their decisions about IT. So a lot of it is education based. I talk to a lot of CIOs. So people bring me in when we really need to tie together, what happens, what's happening in healthcare, and tying that in with how our main product, which is the VMware Cloud Foundation, can help to support those goals and those business outcomes. And then I do a lot of educating our sales teams as well. I do thought leadership. I do events. So you name it, anything that needs to touch healthcare and life sciences, I'm all over it. And then the public sector side of things is relatively new for me, but I'll be doing the same thing there as well.
So, with your role there, obviously you cross a lot of stuff. Healthcare is really broad, but you mentioned something interesting. You mentioned the Broadcom cloud. Can you explain the difference between a public and a private cloud?
Sure. I mean, what we have, the VMware Cloud Foundation is a private cloud platform. So when people talk about their cloud strategy, everyone automatically thinks of the public cloud, especially the hyperscalers, AWS, Azure, Oracle Cloud, Google Cloud. And so those are all public clouds that are managed by those hyperscalers, and they have a number of services tied to them and so forth. But you're essentially renting out their cloud space for use. And what the difference is with Broadcom's private cloud is that we're giving our customers all the tools that they need to create their own cloud on premise or perhaps through a managed service provider. And so that's the big difference is you're able to keep all of that sensitive data in-house and you're not beholden to the complexities of perhaps the public cloud. And so that's really it in a nutshell. It's very simple. We just give people the tools they need to build their own cloud. And then we also have a number of services that go along with that as well.
And so when a healthcare organization is looking at their data and what they're trying to do with it, what sort of features would they consider to put on a public cloud, and what might they move onto a private cloud and why?
Oh gosh, so that is the question of the day. And it's something that we've been validating that with our customer base. And when we first created this platform, we were receiving a lot of feedback from our biggest customers, especially in the regulated industries, about that very question. So where are you putting certain types of workloads? And there was a very clear need for a private cloud because a lot of people were going to the public cloud and they were facing a ton of complexities, facing a lot of cost increases, but even more importantly, they were really concerned about the privacy and the compliance of their data and the security of their data in those public clouds. And so there has been this cloud repatriation that we've seen occur where people are moving certain types of workloads away from the public cloud into more of a private environment or a private cloud altogether. And, so we were hearing this, and then we also wanted to validate this ourselves. So we launched a survey. We called it the Private Cloud Outlook Survey. It was a blind survey, so nobody knew that it was sponsored by Broadcom. We didn't want any biased results. And we got about 1,800 responses across a number of different industries, not just healthcare. I think the healthcare portion, we got about 20% of the responses came from healthcare, 14 from life sciences, 20% from public sector, and so forth. And what came back was a very clear message that people were actually quite happy with some portion of public cloud. But they were prioritizing building and moving new workloads into a private environment, especially those workloads that had that were very sensitive to security and compliance regulations. And so for healthcare, what that meant was people were keeping things like their Epic workloads on premise. A lot of the things that rely on latency and integration with other systems, those are being prioritized for a private cloud environment. And so you have a lot of different types of workloads that touch PHI that need a little bit of extra security, and people are moving those workloads off of public cloud and into their private environment. And we saw this happen in healthcare, but across all of the different industries. And so people are now struggling with this idea of, okay, this decision of, well, where do we place certain workloads? What works best in public cloud? What works best in private cloud? We want to maintain a balance across both. And that's the reality, is people are going to continue having both a footprint in the public cloud as well as prioritizing some workloads for the private cloud. Just a matter of which workloads work best where, and also what's the most cost effective. But yeah, in healthcare, it's all about the highly sensitive patient data, the genomic data, anything that's beholden to HIPAA regulation, GDPR, big data analytics, AI, ML, precision medicine, genomics data. A lot of those have been earmarked for repatriation or keeping on a private cloud environment.
And so healthcare organizations, in essence, are taking these data, dumping in their private cloud, and then they're able to use AI tools and other tools against that to build population health programs, better understand their patients, and still feel secure about what they're doing.
Right, exactly. And we did find as well in that same survey that the majority of people who were developing their own AI tools or their own generative AI platforms, even folks who are, building or using modern applications, they're all preferring to do that in a private environment. I think the exact statistic was 55% of the healthcare respondents in particular preferred a private cloud environment for their model training, their tuning, and their inferencing. 67% prefer to run their containers and their Kubernetes-based applications on a private cloud, or in a hybrid environment that also existed. And so, yeah, when it came to AI, there was a very clear preference for that. The issue, though, is that not everybody, I mean, you probably know this, healthcare providers don't typically have a large number of data scientists. They don't have a large number of developers. And so many of them, aren't necessarily in a position to build their own tools or their own algorithms. Although I think that there are some leaders in the healthcare space who are showing that that's possible and very effective and are giving others the blueprint to do that. So we definitely do see that this, burst of generative AI into the healthcare space is contributing to this repatriation trend that we're seeing for sure. And it's only going to grow.
Absolutely. And one of the things, we keep talking about in healthcare, and Greg and I have discussed this a lot, it's been an issue for decades, is this whole idea of efficiency and inefficiency in healthcare. So how does this kind of technology create better efficiency?
Are you talking about a private cloud platform, or
Yeah.
are you talking about generative AI? Because
When
I
you look
guess
at
both things.
private cloud, let's say, and the
Yeah,
operations of that, et cetera.
yeah. So one of the big things, I mean, yes, of course. So going to your original point about efficiencies, I think no matter what, every single healthcare provider across the spectrum of financial health, staffing health, they're all looking to reduce costs. They're all looking to become more efficient. They're all looking to do more with less, because the reality is there's a staffing shortage across healthcare. Healthcare providers are overburdened. They are facing tremendous amounts of burnout. And it's not just the physicians, the IT teams are also facing that kind of burnout. And there's a really interesting dynamic happening right now where you have IT teams who are spending, I would say, 70 to 80% of their resource, both financial and personnel resource, on just keeping the lights on and managing legacy systems, and just the day-to-day operations, doing a lot of those manual tasks like patching and lifecycle management. They're getting bogged down in all of those inefficiencies, but at the same time, the hospital management, the care providers, the lines of business, if you will, are asking them to do other things like, can you help us qualify and implement AI tools that can help us be more efficient, and can you help us with our workflows? And they're expected to play a larger role in the health outcomes of the patient. They're expected to play a bigger role in reducing costs across the business, across the healthcare provider business. And so you have these kind of conflicting areas where you're spending all your time doing this, but you're being asked to do that. So it's really that run the business versus change the business dynamic that needs to shift. And a lot of folks, when they look at running a private cloud platform or even a public platform, public cloud, they're looking for as many easy buttons as they can get. They're trying to create more efficiencies in that run the business part of things. And so the private cloud platform that we have is helping healthcare teams reduce the amount of time and resource that they're spending on running the business. So we've got a ton of automation tools. I think that's the key word. Implementing as many automation tools in that run the business side of things is really helping IT teams in the office of the CIO shift more of their focus into that change the business side, where they can develop more of those AI tools and qualify them and play a more active role in being change makers within the business, because that's what they're being asked to do. So that's one of the big benefits is in the efficiency side of things, is shifting that focus. Automating as much as you can through the private cloud platform, and then shifting towards AI tools, and then using a lot of our tools. We have a private AI foundation as well that supports that modernization goal that healthcare providers have as well.
Just tuning in, you're listening to Pop Health Week on Healthcare Now Radio. Today, we're joined by Breanne Buehl, Head of Healthcare and Life Sciences at Broadcom. We're exploring how private and hybrid cloud, AI, and secure data platforms are reshaping population health, precision medicine, and the modernization of healthcare infrastructure. Stay tuned. More insights are coming up next.
So, what about this issue of AI and integrating that for, patients and bringing in genomics? How is that being supported?
I mean, that's huge. As we heard before, a lot of folks are choosing to bring a lot of those big data sets into a private environment, partially because of, like I said, the security side of things, the compliance side of things, but also the cost side of things. When we look at a lot of folks who are engaging in, let's say, genomic sequencing, a lot of them do start in the public cloud. And they quickly realize that as they need to scale up, it becomes extremely expensive and unsustainable. So they move a lot of those workloads back on premise, or into a private cloud environment where they can run the analytics a bit more securely. And it's not just genomics, it's everything. So when we're looking at how generative AI has impacted healthcare, yes, we see everything from the operational perspective and generating operational efficiencies. But we also see it being able to impact broader population health initiatives. We see it impacting personalized care and precision medicine initiatives, which is extremely popular right now. I mean, value-based care and the shift to value-based care is one of many ways that we're trying to reduce costs across the healthcare spectrum. And so being able to develop algorithms and doing predictive analytics in a private environment is extremely important. But also, one of the reasons for that is when you're developing tools using the data from your actual population, you're then getting outcomes that reflect the needs of that population. So when people are building these tools on premise or in their private cloud, they're able to utilize more readily the information that they have on hand locally to get the best outcomes for their population. Whereas buying a lot of off-the-shelf tools don't necessarily give you the governance and the ability to adjust for some of those needs that you would get in the private environment. So, but again, not everybody has the ability to build those things by themselves. So from a precision medicine perspective, you also have the ability to utilize generative AI in a private environment to, analyze someone's genome or use, data that covers not just their electronic medical records, but the broader social determinants of health. What's their environment like? And pulling in all of that data to help influence their care decisions and to come up with plans for those care decisions, or then even to communicate with specific patients to help them understand the care that will work best for them. So we have this huge use case for personalized medicine using generative AI. And yes, operating that on a private environment is going to be much more secure. We saw the outage, right? The AWS and Azure outage recently,
Right.
back
Unfortunately.
last month. Unfortunately. Unfortunately, in the headlines, all of it was, how is this impacting, Snapchat? And yeah, okay. But what wasn't in the headlines was how it was impacting hospitals and how it was impacting actual people and patients.
Right.
And, I think there was a big light bulb moment for a lot of healthcare providers, and not just in healthcare, federal government, the public sector, financial services. There's this recognition now that, so much of our infrastructure does rely on the operation of these handful of hyperscalers. But there is a very real fear that, when something goes wrong, then you're seeing the impact across such a broad spectrum of industries and at a population health level, it could be catastrophic, especially if you don't know how long that outage is going to last. Now, I know this last one was an IT issue. It wasn't, it wasn't, cybercrime or any kind of security breach. But I think it still brings to light the fact that, you know, public cloud providers like AWS, they're often described as a prime target for
Mhm.
nation state backed espionage and cyber criminals, just because of the sheer volume of data that it holds and the number of critical services that underpin it globally, that it underpins globally. And so, you can't really ignore the fact that putting so much into a public cloud provider, into a handful of public cloud providers, just kind of increases the risk of
Mhm.
of being impacted if and when they become targets and those bad actors are successful.
Mhm.
So yeah, I don't want to be around when we see how that impacts population health as a whole, among other things. Hopefully it'll never happen.
Hopefully, and I know they work hard to keep that from happening, just as
Yeah,
most of the companies in healthcare and IT are trying their best to try and always stay one
exactly.
step ahead of that issue. What about this issue? I heard, I think it was addressed also maybe in the survey, healthcare facilities want or players wanting to move to a platform and
Yeah,
the use of a platform. Can you talk
yeah.
about that a bit?
Yeah. So right now, the platform way of thinking is a major trend in healthcare. And we see folks like Mayo Clinic talking about how they've remained resilient and innovative because of their ability to shift to this, this platform way of thinking. And I think one of the benefits of that is just sheer simplification of healthcare and the IT environment and the ability to become agile and resilient. And I know those are two very overused buzzwords, but it's true. A lot of healthcare has moved from this growth mindset into survival mode, agility mode, because we've seen that so much can change so fast. We've been through a pandemic now. We've been through, a number of political changes. We've seen tariffs being put into place. We've seen disruptions to supply chain networks. We've seen outages. Anything could happen. And rather than talking about what could happen in the future, there's this idea of now just let's prepare for all eventualities because any number of things can happen. And when you think of using a platform that gives you the ability to be agile and to be in control and to shift when you need to shift, you know, um, especially if you plan to have a hybrid format, so public cloud plus private cloud gives you the ability to move workloads between both private and public as you might need to in order to shift resources here and there, or to manage your costs accordingly. If there are cuts to Medicare and Medicaid, right? So, or if you need to suddenly shift to a new line of generating revenue because you're trying to backfill revenue loss. What are some business opportunities there? Will you be developing AI algorithms to monetize? Um, do you have the ability to set that up and to scale that in the future if you need to? So those are all the questions that we ask of healthcare providers when we're talking about a platform. How are you future ready? Do you consider yourself agile, resilient? Will you be able to expand certain programs without also expanding headcount if you need to? So having a platform is really beneficial because it does give you the ability to do all of that. But also back to the simplification perspective, one of the things that our VMware Cloud Foundation does is, we consolidated a vast number of technologies and products into the cloud platform in a way that can either reduce or replace a number of the vendors that healthcare customers are currently working with. And so there's this vendor consolidation piece that comes into play as part of that kind of simplification vision for healthcare. And so I think that the more that not just VMware by Broadcom, but anybody who's touching healthcare, if we can provide one thing to our healthcare provider customers, it's anything that can help them simplify their environments, anything that can help them be more efficient, anything that can help them be more agile. And let's figure out a way to shift some of that IT resource from running the business to changing the business and remaining agile.
And you briefly touched on kind of looking ahead. And one of the critical issues in population health, obviously, is equity and access. Can you just sort of close us out with 3 to 5 years from now? Which innovations do you see most reshaping that issue?
I mean, equity and access, gosh, those buzzwords have been around forever. We definitely saw them come to the fore during the pandemic. And I think that's where a lot of folks, including myself in my previous role with the British government, worked very hard to solve. I think when it comes to health equity, it's all about the data, the quality of data that is now going to be flowing into generative AI programs and AI programs in general and AI tools. But I think when it comes to health equity and access to care, for access to care, we need to try to reduce the number of hospitals at risk of closing. How can we reduce costs there? When it comes to equity, yes, I think we need to look at the quality of data that's going into these AI algorithms. We need to make sure that they're purpose-built for everybody, and that we are reducing bias in these algorithms. And I think having access to tools that, predictive health tools that allow healthcare providers to do this will be really important. And I think there are a lot of companies, software companies, that are rising to that occasion. And they're coming up with highly accessible population health tools that are focusing on health equity and making those available to different providers, but also not just selling it to them, but giving them the blueprints for being able to develop their own. Because I think at the end of the day, being able to develop their own will be the key to reducing health equity issues and access issues within the healthcare provider's specific patient population.
Well, I want to thank you so much for coming on, Breanne. It's been a pleasure.
Likewise, yeah, it's great to talk with you, Fred.
And obviously, the need for data to solve population health problems requires you have a system to be able to take the data and work with it. So I'll send it back to you, Greg.
And that, dear listeners, is a wrap for today's broadcast. A big thank you to our global audience for tuning in, and an extra special tip of the hat to our guest, Breanne Buehl, Head of Healthcare and Life Sciences at Broadcom, for her powerful insights on hybrid cloud strategy, automation, AI, genomics, and the infrastructure modernization required to truly advance population health. To learn more about Breanne's work, visit www.broadcom.com, to follow her on LinkedIn, or explore Broadcom's latest healthcare and life sciences thought leadership publications. If PopHealth Week brings value to your work, please support the show by giving us a thumbs up on your favorite podcast platform, share the episode with your colleagues, and do subscribe to never miss a future conversation. Remember, PopHealth Week streams live on Healthcare Now Radio every weekday at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern. That's 2:30 a.m., 10:30 a.m., and 8:30 p.m. Pacific. On behalf of Fred Goldstein, the entire crew at Healthcare Now Radio, and myself, Greg Masters, thanks for listening. Stay well, stay engaged, and we'll catch you next time on PopHealth Week.